Channel, changing lives.
Hello and a very beautiful evening to you wherever you hear my voice from. This is Love at Home on Hope Channel Ghana. I am Efia Sewa Mansa. I want to say a very big thank you to Mrs. Charity Agri who sat in last week for me. The topic was so interesting and we want to say thank you so much for always joining this very important show on Love at Home on Hope TV. We are so grateful. July is a very wonderful month. We are seeing so many different things. It's been drizzling, it's been raining, the road has been busy, children are crossing here and there, some are on vacation, some are at home. So parents, what is your plan for them? This weather, please protect the children. It is very, very important that we protect them so that they do not catch flu. There are so many ailments and diseases that may come up. So please remember to protect your children at this time. Today we want to discuss preparing and managing pregnancy. Yes, I'm sure you are wondering why we are talking about this. As a family show, it is important that whatever we set to do, we plan. It's the same thing when you want to go into marriage. Same thing as you want to go or you want to become a parent. So becoming a parent goes through a stage, and so you must plan. And what are these processes that must help you to be a good parent? If you want to become pregnant, I'm sure you have to plan. There are financial obligations there. What about your health being, your well-being? Do you need some exercise? What about your dieting? This and many more is what we are going to be discussing on today's show on preparing and managing pregnancy on Love at Home. Yes, it is time calling every member of the family, the children. For those young people, young women, please, it is time. Come, learn and unlearn and relearn. To that young one over there, please, it is time. For those newly married people, let's learn to help as we prepare to go into new families. I am Efia Sewa Mansa. And with me to do this wonderful discussion, on my far left, I have a very radiant lady. Yes, you can check her smile out. Madam Esther Asantua Akoto, she's a midwife. And you see her on TikTok, Facebook, talking about midwifery things. And she's good at that. She's here to help us share and give us more knowledge to prepare us as we want to become good parenting, right?
Yes.
All right. So, Mami Esther, good evening.
Good evening.
This your smile is killing me. How was your day?
My day was good, even though it was stressful, but so far so good.
Yeah, taking care of human beings has never been easy. So you see how Jesus suffered.
We give all the credit to him.
Yeah,
anyway.
he's been doing well, and you are doing well, and we appreciate it so much.
Thank you very much.
Thank you. We are grateful for joining us on Love
Thank you
at
for
Home.
having me too.
Thank you so much. And a very fresh, young, and beautiful or handsome, I don't know what to say. He's a doctor.
You flattering.
Oh, you say I'm flattering, but I know you know that I'm not. Yes, Dr. Daniel Adote is also here to help us. Dog,
Yeah.
good evening.
Good evening.
How is your family?
Yeah, doing well.
How is Madam doing?
She's
You
doing
cannot
well.
be on this show when I don't ask about Madam because it's a family show. And so I want to make sure that your family is doing well. My regards to her and tell her that I love what she's doing. You should continue doing them well.
Okay.
What about the consulting room today?
Everything went well.
Okay, we
Yeah.
thank God. And to you out there, I want to officially welcome you to say, Ayuko, please sit and let's talk about preparing and managing pregnancy. It is so important. Now, I want to start with you, Mami Esther.
Okay.
What do you mean when somebody decides, okay, what are the key ingredients for somebody to consider if he wants to become a parent?
Okay, so basically preparing for pregnancy as the topic we're going to discuss today, it's a journey on its own that one needs to plan ahead. It is not something that we usually say that it came by mistake. It is something that we plan. So you need to consider one or two things to be sure if physically you're okay, emotionally you're okay, psychologically, with every aspect of your life, you're okay. So some key considerations that couples should consider before planning to conceive or planning to make a family is the fact that they have to know if they have any chronic disease that can affect the pregnancy in any way or can affect conception. So a condition like hypertension, diabetes, just to mention a few of them. And then also their lifestyle. If the person is someone who lives a sedentary lifestyle, you tend to become obese. And then when you're obese, it affects your fertility rate because your BMI becomes higher and then it affects your fertility rate. So you need to live a healthy life in order to maintain a good body weight that will help you in preparing for your pregnancy. And also, some people might be taking some substances that it is not advisable when you want to plan on becoming pregnant. Something like tobacco, caffeine, smoking and drinking alcohol and all that. I think there are some of the things that one needs to desist from before planning to conceive. So some key considerations that you need to do is your health, your medical health, your lifestyle, and then taking into consideration your nutritional status too. It's very, very important.
Hey, this is no joke. So then I now understand why you said it shouldn't be a mistake. You should really plan. But do we really do that, Pastor? Do you, Doc? Do people to go through this? Do they make sure that they are differentiating themselves from all these?
It's quite unfortunate that in our part of the world, a lot of people do not plan, and then when you don't plan, you plan to fail. So deliberate action not to plan means you are planning to fail. Ideally, there are certain pragmatic things that you need to go through. Because, as she said, it's a journey. It's like putting up a house. You will not get up one day and say, I'm going to build a house. There is a saying that you build a house in your pocket before the house comes into reality. So, pregnancy in itself, it's a whole journey. It's a whole work that needs proper planning, that needs consultation, that needs assessment, both physical, emotional and mentally, because if you don't do that, then it means you are not helping yourself, you are not going to help the fetus who is going to come, you are going to be a burden to a family, not only their family, you're also going to be a burden to the
community and the society.
Yes, at the end of it all, you are not the only one going to suffer the consequences. We are all going to suffer the consequences. So she mentioned some key areas, but I would want to add few things to what she said. There is one thing that I've hardly seen that being done. That is what we call the preconception checkup.
That was my next question for you. The Holy Spirit is talking, so please go ahead then.
So when we talk about preconception checkup, conception may be too big. So when we say conception simply means an act of getting pregnant. Yes. So preconception simply means before getting pregnant.
Okay.
So these are checkups or medical checkups that we do before you get pregnant. When you go to see your healthcare provider, he will take you through a series of tests, series of examination. You would have to do a lot of things. They will assess if you already had a medical condition that will affect you in future. So it has a lot of importance. So this preconception checkup, I've hardly seen people coming to do that. You can do it even if you've already given birth before. You can do it a year or two whilst you are planning to get pregnant. You need to go and see your healthcare provider for them to assess you, to give you the proper education and counseling. They have to do all the necessary laboratory investigations and do all other clerking that they are supposed to do in order to see that you are going to minimize risk. That is the first thing. Because the case of maternal mortality and morbidity, it's not too good. So with a pre-conception checkup, you are able to identify those risks. There are people who will be able to identify risks like preeclampsia. There was a day we called a preeclampsia day. I don't know if you...
Yeah.
Yes. So people, a lot of people die through this preeclampsia thing. A lot of people lose their babies through this preeclampsia condition. But with conception checkup, you'll be able to identify and rectify those things. Yeah. Your mental health, very, very important. Because I'm coming from a mental health background, I'm so much particular about I'm very passionate. I have the passion for mental health. Oh. Yes. So it is, your mental health is so much of importance. You need to know how to practice stress and stress management. They will have to take you through a series of education where they will teach you about nutrition. And it also helps in fetal growth and development. Yeah. Yes. Sometimes there are people who have had birth defects before. People who have had abortion. When I talk about abortion, all attention goes to that someone have taken a particular medication and then the child has been aborted. Any pregnancy that gets terminated before the 20th to 28th week of gestation or pregnancy, we term it abortion. Yes. WHO have their standard, and some other countries also have their own standard. Some will tell you 22nd week. Some will tell you 24th. Even in some books, they will tell you 28 weeks of gestation. So if there is termination of pregnancy or the product of conception come out, then it's abortion. Some is spontaneous. Yes. Some is also induced, deliberate. They take medication or they do what we call the evacuation of uterus. Yes. So when it's spontaneous, you do not take any medication. You've not taken any medication, and all of a sudden you see bleeding. You go and do a scan, and they tell you that it's a complete abortion, or the product of conception have come out already. Yes, with this, you need to have a pre-conception checkup. At least maybe something went wrong. Be able to rectify it and help you out through that.
Anyway. This is great. Now, let me come to you, Mami Esther. If one wants to get pregnant, must the person consider his or her diet, exercising? What lifestyle changes or modification should this person consider?
Okay, so when earlier on I made mention of the fact that you need to maintain a healthy body weight. And then it all boils down to our diet and then our exercises. Because when you are too obese, when you are fat, it affects the rate at which you can become pregnant. So usually, like as doctor said, with the preconception care, you go through that counseling. If you realize that we check your BMI, if your BMI is about 30, then we try to manage it so that we get at least a moderate BMI for you to enable you to also conceive successfully. Another thing is that when it comes to people lately, because of work, you go to work, you close, you come home. You don't really engage yourself in any exercise. We're not saying you should do any vigorous activity, but at least taking a walk, taking a stroll, and then also making sure that the food that you take in does not contain a lot of fat. Lately, roadside food, Indomie, we'll go and buy, fried rice, and it contains a lot of oil. If you don't even know the ingredient that this person is using to prepare the food. So we try as much as possible to reduce certain food that we take that might put our health at risk, especially when it comes to issues of trying to conceive. So you need to maintain a healthy body weight, exercise. And then if you are someone, as I said, if you are someone who smokes, who takes in alcohol, or any substance like caffeine, tobacco and all that, you have to try as much as possible. If you can't stop, our doctor is here. He can take you through it, like that counseling for you to overcome it, and then later try and then conceive, successfully.
Yeah. Yes. That is great. Well, doctor, because you are so passionate about mental health, what is the role of this mental health and the emotional aspect when someone is pregnant?
Yeah, so when someone gets pregnant, a lot of things go on. There are a lot of changes that happen to the person, and I don't know if you permit me to mention some few, then I'll based on that, we'll drive through that angle. A lot of physical changes, there are physiological changes, and emotional changes. So for physical change, you can see they do gain weight. Sometimes even the skin color becomes darkened. It changes, even the hair color changes. and then
Your
the
hair starts
breast,
to pull off, come off.
and then the breast becomes so tender.
Yeah, tender.
These are all physical signs you may see, and there's some physiological signs. That's the physiological signs. When I talk of physiological signs, I mean the medical aspects of what goes on within your system. You realize that such people, they urinate frequently because the uterus is becoming big, pressing on the bladder. So the little urine that is being collected into the bladder would have to come out. Yes. Most of them do experience this indigestion and heartburns because the organs are being pressed. So if you eat small fatty foods, you realize that you begin to have heartburns. Or you finish eating, you lie down small, you realize you have heartburns. There's constipation. There are a lot of activities. Things are changing. But there is one important thing I will also talk about hormones. There's hormonal changes.
Imbalance and changes.
Yes. And one of the hormones is a human chorionic gonadotrophin. And we also have something, in some terms we say it's a neurotransmitter. We can also term it as a hormone. We call it the endorphins because it's preparing your system. So these endorphins, what they do is that they are able to, it's like a painkiller because they used to have back pain, some pelvic pain. They go through a lot of pain, whilst especially at the later part of pregnancy. So these endorphins begin to increase in your system. Now, just after delivery, the endorphins will reduce. And one thing that the endorphins does as a neurotransmitter is that it helps in excitement. So if these endorphins are reduced, which helps with excitement and elation, what will happen to you is that your mood begins to drop. Sometimes there are neurotransmitters like GABA, gamma aminobutyric acid. There is serotonin, and there are a lot of changes that happen whilst you are pregnant. So a lot of pregnant women begin to have mood swings. Our term will say it's labile or lability. Yes, it's an affect. So the person, you talk to the person within 1 minute, he smiles with you nicely. Then the next thing, she's angry with you without a cause. And you ask yourself why. So this boils down to mental health issue. That's where if it's not well managed, just after giving birth, I'll talk about it later, then it begins to give problem to the woman after giving birth. Some end up with postpartum psychosis and other things. Doctor, so mental health is something that's so crucial.
You are so passionate about mental health, and I like the angle you are talking about, where you are mentioning all the endorphins, the GABAs, and all that, the neurotransmitters, and how they help. But I want my viewers to get more. So let me go for a quick break.
All right.
When we come back, Doc will continue with us. It is very important as we talk about mental health during pregnancy. We'll be right back. Please stay tuned. Thank you.
In Tamale, many live with silent pain, waiting for a miracle. From August 4th to 8th, that miracle arrives. Join us at the Dakpema Palace forecourt for the Healing Hearts Medical Mission. 5 days of free medical care brought to you by Hope Channel Ghana, United Service to Africa, and partners. Enjoy services like health screenings, eye and cataract surgeries, dental care, diabetes and hypertension checks, counseling, medication, and more. Absolutely free. Need surgery? Pre-book now at the Tamale SDA Hospital from July 1st to August 1st. Call 0246 012 655 or 0244 900 931 for details. Healing Hearts 2025, because Jesus still heals.
Real Talk is back. After a brief break, we are thrilled to let you know that we are back stronger, bolder, and even more active than ever.
When he makes you feel that what you are doing is senseless, who are you? Sit down. When we are talking, you don't talk. When he began to control you with the power that I am the man of the house. So when I tell you to shush, you need to shush. Don't go there, you don't go there.
We've truly missed you, and we are excited to reconnect and dive into the conversations that matter most. Each week, we take on issues, challenges, and experiences you share with us. Real Talk, a space where real stories meet real solutions.
Hello, my lovely viewer. I am so grateful that you waited on us and you are watching Love at Home on Hope Channel Ghana. Yes, and we are discussing preparing and managing pregnancy. We've talked at length about what it means to be pregnant. What does it go into? What should you be preparing for? And they've talked about planning, eating well, your diet, exercising, and so many other things. But doctor was so passionate when he was talking about the mental health aspect during pregnancy. Doc, I want you to continue, please. Thank you.
So I was talking about some neurotransmitters that do some changes. So there are sleep disturbance due to the gamma aminobutyric acid neurotransmitter, as I said. There is alteration. So it causes sleep disturbances. But with that, with reassurance and little exercise, there are ways we will manage it. We'll come to that. So when it happens that way, it boils down to the fact that one needs to manage his mental health very well. Stress management is so important during pregnancy because due to the serotonin and due to this, what's the name, hormone, estrogen, progesterone, they have a contribution when it comes to stress. It's linked to stress. So as there are alteration and changes in this hormonal interplay, there should be the need for stress and stress management. Other than that, you would see someone is pregnant. She's not able to take care of herself very well. She'll be working and be talking to herself because she doesn't have any support. A lot of things are going on in her mind. And that is where she needs much of our help.
More importantly, when the person realizes that her body has changed, he can't explain, she herself doesn't understand what is happening to her and all that.
Imagine someone who have a career and would want to attain a particular status, and all of a sudden
pregnancy.
They not plan for it, but she get pregnant. She needs much psychological counseling.
Wow. Wow. Now, let me come to you, Mami Esther. What are the most common challenges expectant mothers face?
Okay, so
during the pregnancy stage.
Okay, so we are categorizing it under the trimesters. I always say that during the first and then the last trimester is the most difficult part of the pregnancy journey because there's something new that is happening to you, especially if you're a first-time mother. There's something new. You are going through emotional changes, physical changes, psychological. Your body is in a total change because at first you had the slim, Coca-Cola shape, and then all of a sudden, because of the growing uterus and then the abdomen becoming big, you feel like you're out of figure, and then you don't even feel like stepping out. So at that moment, if you don't, as the doctor says, if you don't counsel the person very well, this person is likely to enter into a different condition. And then they also come with some morning sicknesses like the nausea, the vomiting, and then to the extent that some people will tell you that I can't even sleep at all. There's heartburns, there's constipation. It's a whole lot. So depending on the presentation that the patient comes, you have to do an individualized care. You shouldn't say that because it's normal in pregnancy, therefore it should be normal for everyone, then you manage it as that. No, you need to treat them individually presenting with
by
a
case.
complaint and then managing it as such.
Okay.
So with the first trimester, if someone is able to pass through the first trimester successfully, then we believe that the subsequent ones is going to be successful.
Sure.
We are going to have a lesser complication.
Right.
And then also during this period too, we advise that because you are bringing out a whole human being, you are carrying a whole nation. I was saying that
Yeah, a whole
whole
nation.
nation inside you. At times, as doctor said, emotionally you become so down. You see this person all happy in the morning, and then later you talk to this person, and then she doesn't even want to hear anything. She's isolated. It doesn't mean at that period you should neglect her because of her attitude. But that is the time you should get closer. Try to inquire from her what is really happening. If you're able to talk to this person, the person is able to open up to you. Maybe it wouldn't be anything serious that might need any medical attention, but just a conversation. I just need to have a chat with you. That is all. So during those periods, if you're able to manage, it helps the pregnancy to go through a successful journey. And then another thing that I also talk about is during that period, people, if they have a pre-condition that might affect the current pregnancy, like I said, hypertension, we can have preeclampsia in the near future. So we need to manage you at that point. Try to make sure that we normalize the BPs before the person gets into the second trimester and then the third trimester, because usually it becomes worse during the second trimester. So with these, we try as much as possible to manage them. With the morning sickness, you can advise them to take in like maybe dry snacks, eat in bed, not at a goal, eat in bed. Try to also take in maybe something containing mint, ginger, to suppress that nausea. And then also avoid the triggers. Maybe when you're in an enclosed area, you feel like throwing up. Or maybe when you see something, you feel like throwing up. So you try as much as possible to identify all these triggers and then try to restrain from them. Right. It will help you throughout the first period of your pregnancy. And then others too can come with something that we call spotting or implantational bleeding. You don't have to ignore that because it's something that is of concern. Some implantational bleeding might be a real bleeding. It's not because the uterus is implanted. No, it could be something else. So you need to address individual issues that are being presented to you as a healthcare provider.
I would love to come in small with the implantation bleeding. People used to say, even when I'm pregnant, I still have my menses. So the last time I was pregnant, I was still having my menses. So this particular pregnancy, if I'm bleeding, it's a normal thing.
So in that case, they will not seek medical attention.
Yes. So you can't be pregnant and be having menstrual flow. It is not. That is not it. The thing is called implantation bleeding. It's a form of bleeding, but it is not a menstrual flow. So people need to take note.
To be aware of that.
Even if it's just a spot, try to see your physician, your healthcare provider. He may let you do some scan and rule out any form of abortion. It could be an implantation bleeding, it could be an abortion, it could be anything. So you need to do further investigation before you arrive at the point. You don't sit at home and say, oh, this is just a normal thing. As for me, when I'm pregnant, I still have my menses. It doesn't work that way.
Now, let me ask, must I be financially secured before I start thinking of having a baby?
Yes.
Or is a gift from God? So after all, what?
Babies are gifts from God. However,
just the way you're saying however.
Just like
there's more to it.
Just like building a house is a blessing from God. You do not get up one day and put up a house.
All right.
You need to build it in your pocket first. Same applies to pregnancy. It's also a blessing. But you need to make a conscious effort for the health of the fetus and your health. You know, for preconception, you need to prioritize your health first and the health of the unborn.
The baby.
For all of us to live peacefully. So if you are planning of getting pregnant, you have to be financially sound. Sometimes you can take this advice, you can start saving.
Yeah.
Let's say next year, I'm planning of getting my wife pregnant, or I'm the woman. Next year, I want to get pregnant next year. So I start saving this year. You name it, the name of the child's name
becomes
the
a project.
Becomes so
The
you
name,
start
the project
saving
name.
small.
Towards it.
Towards it. If it gets to the time and even the man is not around, you don't go through this emotional, psychological stress.
Yes.
There are some people, they will tell you that with money on them, they are okay.
Yeah.
Some people are sick, not feeling too well.
And you don't have money.
Not because of any
Anything.
physiological disorder, but because of pocket disorder. When the pocket is not good. When your pocket is not good, you are sick. You are not feeling well.
Yeah.
When you actually define health, it talks about financial
Financial
aspects as
aspects.
well.
That is true.
So, and because of the things that one goes through, going through antenatal, the scans you be doing, the labs you have to supposed to do, in a case where you have to go to the theater through CS or anything, everything is money. So you cannot do without money. And if at that state where you are already going through stress,
And
at
you're
the
now
same
thinking about
time,
money.
you are now thinking about money, then I'm very sorry to say you are not ready. So before you go into such blessing, you need to first of all secure your pocket and also plan ahead
So God should
financially.
bless our pockets as well.
Exactly.
That
And
is
then I
it.
also want to add that in as much as you are planning, we are planning for the unforeseen. Because some people might go through a normal pregnancy without any complication. Others, to at a point, it begins very nice, and then getting to the middle or the latter part, you realize that this person has to see a gynecologist or a specialist. Maybe after even the delivery, the baby has to see a specialist. Where are you going to get all those money from? There's an extra expense that has come in. So you need to plan for the unforeseen so that in case anything should happen, the money is already available and they wouldn't put a lot of stress. Because if, at that moment, if you're not able to manage it at that time, then we should understand that approaching postnatal, you're going to have a big issue, yes, in order to maintain that mental health of the woman and that of the man.
Baby.
And then the baby is going to be very, very difficult.
Now, Esther, I want to know, if I am I'm visiting the antenatal, what should I know? I mean, what checks? What should I be
as
aware?
in your first time of coming
my
to the
first time,
hospital?
or even as I mean, my first trimester, second trimester. What should I know during my visits? What would occur?
All right. So, if a patient walks in, I'm pregnant. It's just a saying that I'm pregnant. First, we need to confirm the pregnancy. So we are going to do either a blood. We are going to withdraw a blood to test for pregnancy, or we are going to use a urine to test for it. And after that, we'll follow up with an ultrasound scan to at least get to know the gestational age of that pregnancy. From there, we can do the vital signs, because we need to get a baseline vital so that we build upon it. If you are seeing any abnormalities, then we can manage you as such. And then also when you come, you're going to go through a physical examination, an abdominal examination, a pelvic examination. We are doing all these things to identify some things that might affect your pregnancy, especially when it comes to the abdominal. We want to rule out any previous surgeries that you have undergone that is going to affect the pregnancy. Like someone has done a myomectomy or a fibroid surgery. We need to also be aware, or the person has even had a baby through a cesarean section. We have to assess it. It will help us plan ahead. And then also do a counseling session for them. You talk to them about the progress of their pregnancy when it's continuing, the progress of their pregnancy. And then we also engage them in a prenatal classes, which is very, very important. Now every hospital is practicing it because it helps to also build a support group for them. When pregnant women meet, they try to share their experiences. At that moment, if someone is going through something, then she feels that I can't share it. Someone might be going through it, open up a question, and then it also solves her problem. So we try to take them through prenatal school to help them understand the journey of pregnancy, some conditions that they are supposed to be looking out for, that they need to report to the hospital for further management, and then how to even prepare for the delivery period.
Process.
Yes, so the things that you will need and all that. And then during the antenatal visit, we try as much as possible to engage the specialist, that's the gynecologist. Because at a point, every pregnant woman needs to see an obstetrician, because we know that pregnancy is a whole journey. And then we doing the midwifery aspect, doctors have to also come in to see the state of the baby. Sometimes they'll go and take a scan and they realize that the baby comes with a lot of gross abnormalities. There's no scalp, there's no head, maybe the limbs are not there and all that. You don't need to overlook it. You need to refer. A patient comes, the baseline vitals, you are realizing that the BPs are high. You don't just tell the patient to go home. The patient needs to see a medical doctor to take it up from there. Maybe patient needs psychological counseling. So it's a holistic something. It is not something that we just focus on, just the pregnancy, but a whole individual.
The well-being.
Yes, so we are taking the spiritual aspect, the physical aspect, psychological, emotional, every aspect that will help this pregnancy to go through successfully.
Wow.
Yes, so basically
This
that
is
is
deep.
what it's very deep.
Yeah, Doc, I can see your mouth. You are doing this. You are doing this. Please add on.
It's a multidisciplinary approach
Okay.
where only it's not one man show, but a lot of people comes into play. That's what she just mentioned, because there are times people will test for pregnancy. It's positive. They don't see the need to start antenatal.
Oh.
They feel I'm pregnant and maybe I'm a nurse, I'm a doctor, so there's no need to go to the hospital. Some, they don't even see the essence of going for antenatal.
Yeah.
Some would want to wait
Yes.
for some months.
We encounter that.
Those
a
days,
lot.
they were telling us, oh, don't let anybody see. So you wait. When you get to one stage, then you go.
It's still there.
It's still there.
It's still there.
Does it pose any danger?
A lot.
I've seen clients who have come to the hospital. I tested them, and the pregnancy was positive. We did pelvic scan. We didn't see anything. I had to let her do an abdominal scan, abdominopelvic, before we realized that the pregnancy was somewhere. That's what we call ectopic, outside the uterus. So with that, you need to see your gynecologist.
That one is deadly.
Very. So you can imagine when it ruptures.
Yes.
So some people will stay at home until that emergency occurred to them. And if care is not taken, you may lose your life. So the essence of antenatal, it's so crucial. It's so vital and crucial. Because just as the midwife said, there are times where there are defects, malformation, and all those stuffs. Maybe the child does not even have a hand. The fetus doesn't have a hand. Or the skull, he said the whole skull, there's nothing in it.
So some of the birth that we see, that comes with defects, some of them, they are as a result of not going through the right processes of checking.
Exactly.
Because ideally, currently, before from 18 weeks to probably 22 weeks, we do anomaly scan to rule out these abnormalities that we're talking. Because at that time, we can manage it.
Yes.
We can do a termination of pregnancy. If it's something that is going to affect the health of the baby, we need to terminate it at that moment. Others too is something that we can correct after birth. So we try as much as possible to look out for these abnormalities and then also plan ahead. So when a patient decides, I want to be in the house after testing positive for pregnancy, and maybe takes a scan to confirm if it's in the uterus, this person will stay at home because I'm taking my folic acid or my multivitamin, everything, so I wouldn't come to the hospital. You shouldn't forget that you don't know what is really happening in there.
Yeah.
You feel that you are fit, you are okay, you are going
about the
up and
fetus?
about. What about the baby in there? You need to come for us to also assess the baby, the heartbeat. How is the baby growing? Is there any abnormalities, even with the placenta that is also forming? Where is it located? Where is it positioned? Is it something that is going to affect you? But some people tend to ignore all these things because of, how the country that we are living in. People think that if I show my belly to people, then it's either they're going to harm the baby or not. So I'll keep it to myself. And then maybe after 5 months, then you can't do anything to it. So after 5 months, the person will start. At that 5th month, you might come and then, as doctor said, something different has happened. And then what are we going to do? We need to go in and probably bring out the baby or any other management we are supposed to do at that time. Meanwhile, we could have done something about
solved
it at
yeah,
the earlier
at the
stages. Yes.
yeah.
So you advise that immediately you test positive, even if you don't want to start antenatal, just go to the hospital. Confirm if the pregnancy is really occurring within the uterus and not outside the uterus. At least for that, we know that you are safe. And then whenever you want to start, but you have to have, that is why lately we are doing a focused antenatal. You need to have a midwife friend, talk to the person, let the person know your state. Maybe I want you to come and visit me in the house because I don't feel comfortable coming out.
Yeah.
Yes, so I want you to come. Yes, we can do that. There's always an exemption. We can come to the house, assess the baby, and then possibly refer you to the hospital for further management and investigation.
Mami Esther, you also talked about support system where you do classes, and I'm sure in that case you should have some manuals, some books that you give.
Yes.
What support can friends and family play in a pregnant woman's life?
Okay, so this journey is not an individualized, it is a whole group. So the husband has a role to play. You need to provide your wife with the emotional support that she needs. She's coming for antenatal classes. At times, we know how busy our husbands can be. But a day, just skipping a day and then attending the hospital with your wife makes her feel good. So let's try as much as possible to support her emotionally. Coming to the hospital with her, also learning certain things that you might also teach her while she's at home. Because we tend to forget, pregnant women tend to forget a lot. She came today, we thought her
the hormones are working, you know.
She came today, we thought about maybe signs of hypertension in pregnancy. At that moment, she understands. But when she goes home, everything is gone. But if the husband came with her, she knows that, okay, so this is what the midwife said, and I'm seeing these signs with you. So let's call the midwife and then also explain it. So providing that emotional support also helps. And then also trying to help her with the house chores. It shouldn't be a lady's thing. You realize that when you go to most houses, the women are virtually doing everything. She's sweeping, she's washing, she's cooking. Even if she has a little baby, she has to put the baby at her back, and then with this big abdomen going up and about, it's not helping. Mentally, psychologically, it's not helping the woman. So you need to help them with, and then the family too has a role to play. You need to encourage the woman that we are with you in this. It is not you, because at the end of the day, you are bringing a new member into the family, and then we can't wait to meet. So please, be okay, be fit. Talk to the person, talk to her, engage them in a conversation that will help them to also know that, yes, I belong to a family that is really waiting for my baby to be born, and then also, how do I even put it, have that relationship that she's already experiencing. But if you're not getting that support from them, then I don't know how the pregnancy is really going to end. So we need to do that.
Wow. So now I want us to look at preparing for childbirth and parenting. There are different birthing systems.
Yeah.
How can parents be informed about these different types of birthing and which one to choose from? Because there are some people, they are like, hey, me, I don't want to push. I hear pushing is difficult. So some years ago, one doctor asked me, Afia, which date do you want your baby to come? I'm like, what is happening?
Are you good?
Which date? Oh, we can help you. If you have a role model and you want your baby's date to coincide with that person, we can do that for you. And so, what is this whole thing? What is happening?
Yeah. Before I go into it, there is something I left out there, but I think it's fair. It could be a question that will be on the lips of a lot of people.
Yeah.
Okay. When we were talking about the antenatal, someone is watching us and the person is asking, so when should I start? Okay. I've tested positive. So when should I start? And for how many times should I
visit?
I would want to touch on that. And she said something about focus antenatal. Just briefly talk about that, and then I'll move on to your question. Now, the moment you see that you are pregnant, you've done urine pregnancy test, blood pregnancy test, you have to go to the hospital to see your midwife as soon as possible. Before the 20th or 28 weeks, it should be every 1 month. So before the 28 weeks, you could go like 2-3 times. Then from the 28 weeks, I know every the facility have its own protocol, but WHO standard will tell you that from 28 weeks, it should be bi-weekly. Till 32nd week of gestation, or 36th week of gestation. And then from the 36th week, from WHO, it should be weekly. Until the child, until delivery. And she made mention of focus antenatal, and I want to bring our viewers to the understanding of that. When we talk of focus antenatal, it's about getting one midwife. You go, she takes care of everything about you. Today, you go and meet her. The next day, when you are going, the same woman, she will attend to you. So from the time of conception till delivery, she had become like your friend. She does everything for you, but unfortunately, sometimes it's not visible due to the number of midwives we have and
the ratio.
It may not be possible, but just get a midwife friend. Sometimes clients come to the hospital and they find the nurses, the midwives, whoever is at the hospital, or petty things.
Please forgive them all. It's the hormones.
So today I come and then I'm meeting Madam Esther. Tomorrow I come, I'm meeting a new person. You know, there's a confusion.
It's like a vehicle.
You don't know where to start from.
Good.
When I first bought a vehicle, I was told that I should have one mechanic. He will know your problem. So the moment you send your vehicle to the mechanic, the mechanic, he knows your problem already. It's not now he's coming to do try and error. So focus antenatal is something that is so crucial and it's very, very good. So coming back to your question, please, your question again.
My question had to do with the birthing system. The birthing system and how parents can decide, can be informed to choose the type.
It depends on a lot of factors. Sometimes you do not have control over the birthing system. Sometimes do you have a control. There are some people, we have surgical. We have the surgical, and then we have the normal delivery. We have the normal labor and abnormal labor. Yes. So we have the normal delivery where someone will go through what you call SVD, spontaneous vaginal delivery. We have the cesarean section. So, but there are cases, there are instances where the baby is too big and the mother will not be able to push. At that instant, sometimes it will be even it's later during the time your last scan before they were able to detect that because of this you cannot go through the normal delivery system. It's not a crime. The moment you mention CS, people think they are going to die.
Oh, in our part of the world, they'll tell you that they'll tell the mother is, they'll say the mother is a lazy. Hey, me, your mother-in-law was able to do this. I did that. You did that. Why is it that you alone are going through CS? You're a lazy woman. Is that the case?
It's never.
It's not.
It's a matter of choice.
Okay.
Sometimes
is it choice or ability?
Sometimes a matter of choice, sometimes it's ability. It can be your choice. That's for me, I don't want to go through vaginal delivery. I want cesarean section. People opt for it. They do it without much problem. People are working about cesarean section, they've not had problems. So it's not a big deal. And it shouldn't be a prayer warrior topic because somebody is going through CS. So we need to fast spend the whole midnight. It's something unheard of. No, it's a medical, it's a surgical procedure, just like normal delivery too. You still have to pray for the person. The person going through CS, you still have to pray for the person. So for the informed choices, it depends whether to go through CS or to go through the normal delivery. It depends on if there is no implication for cesarean section. I would say the normal vaginal delivery, spontaneous vaginal delivery is the best. However, it depends on the couple. I know when it comes to counseling, I learned a little bit about counseling. You don't advise, but you rather give option.
You guide.
So you guide, and then they will pick the best. The person will make
his or informed decisions.
That's the little I know about.
So you open every aspect of the person, and the person chooses what he wants.
So the couple, they are the family. They have the final say. they have to sit down. Right from the beginning, you have to plan. Do I want to go through normal delivery? Yes, you can plan, but sometimes there may be changes.
Yeah.
Something may pop up,
Yeah.
and then it will change. And you going through CS for the first time doesn't mean that all your pregnancy you are going through CS.
So that statement is not true. Where you say once you start CS,
No.
you're first, second, third,
No, no.
and you can't go beyond four.
It's
not
never
true.
true. It's
Please
not
tell
true.
me more about it.
Okay, so as doctor said, there's always an indication. If there's an indication for CS, you have to undergo it, especially when we realize that the baby is big, and then there's your first time mother, primary. We assume that the pelvis, the space there is too small for that baby to come out. Therefore, we opt for cesarean section. Maybe your subsequent pregnancy, you're having a baby weighing 2.5 kg, which is a normal, and then the interval, it's about a year and a half or two. Then we will try labor for you to go through the spontaneous vaginal delivery. So it depends on the situation surrounding the pregnancy. Some, after cesarean section, you can go through SVD for the rest of your pregnancies. Others too, it tends to repeat itself. So I'm giving birth to big babies, big babies, big babies. Then you, this person, you're going to have a series of cesarean section. So you decide that maybe I've gone like 3. I think ideally it is the highest number you can go is 3 for the cesarean section, then you are done. But if that indication that we saw in the previous pregnancy is not repeating itself, then we allow you to go through a spontaneous vaginal delivery.
You have lots of education to give us. You have lots of education. But now, I'm sure if I leave you guys here, we will talk. But now, I want us to look at postpartum depression and considerations. What should parents be aware of regarding postpartum recovery and mental health? Once again, I'm coming to your area.
Yes, because that's his area.
That's a puerperium. So we have what we call puerperium. That's the first, mostly the first 6 weeks after the last stage of the labor. We have stages. Labor is just like stages. So we have the 4th stage. That's after the placenta had been delivered. Then puerperium starts, or postnatal starts. So from that time to 6 weeks, we call it puerperium. A lot of activities, a lot of things changes. The hormones begin to go back to normal. Within 72 hours, you see estrogen and progesterone going back. Within that frame time, within that 6 weeks, you realize that the uterus, the weight can even change from 1,000 grams to 100 grams.
That fast?
Yes, the organs begins to regress to their normal state. There are a lot of changes, hormonal changes, endorphins. I told you during labor, you're going to go through pains. So God have made it in such a way that the labor, even the pains you are going through, God is helping you, giving you analgesic by giving you more endorphins so that you'll be able to withstand the labor. So just after delivery, the plenty of endorphins is no more doing its works in their system again. So they have to reduce. So endorphins going back to normalcy. Within 2 weeks, if you check for urine or pregnancy test, blood pregnancy test, human gonadal trafficking is going to be negative. But within that, before that 2 weeks, you are likely, even after giving birth, you check and it's still positive. Yes. So it's like a transformation that you go through within that particular 6 weeks. There is what we call lochia. It to come to play, but I'm going to go. There's a discharge.
Okay.
Yes.
All right.
Yes. But I want to, because of because of our time, I would want to jump quickly into the mental disorders that mostly the person may go through. Let me not forget about infection, sepsis and infection, puerperal infection, puerperal sepsis that may come in. But let me go to the psychiatric disorders. There is what we call postpartum blues. Postpartum blues. Just after delivery, there could be an extreme, abnormally extreme sadness that may happen to the client. They can just pick the baby and throw the baby away. They will bounce to crying, talks to themselves, and become so depressed. I will not use the word depression, but they become so down and low self-esteem and going through a lot of psychological problem. It may range between few hours to 10 days, and it may resolve by itself.
Wow.
It has a cause. One of the causes I told you is about the decrease in the hormones, the serotonin, and also we have triggering factors. You are looking for a male child, you didn't get a male child, you got a female child. The sadness alone, instead of the husband to support, the husband will not be supporting. Maybe the woman wanted to finish a particular career before giving birth. It has happened. So as the endorphins has reduced and going through this emotional stress, it will trigger. And then the person may go through what you call postpartum blues. And if care is not taken well, not managed, the person may have what you call postpartum depression. Postpartum depression. And that one mostly could last from weeks to months. And depending on the severity, we may give medication, we may give psychological counseling and other things. And another thing I'll talk about is postpartum psychosis. This is a whole topic that we need to have a time.
Stages.
Yes, we need to have a time to talk about it, because people are going through a lot. And if imagine you enter into postpartum psychosis, it becomes chronic, it becomes part of you. You start taking medication, and so our mental health needs to be well taken care of. We need to be well informed about. So we have a lot of work to do. But because of time, I wouldn't talk much, because if I'm to talk about postpartum depression, postpartum psychosis,
it will be another topic.
It's going to be another topic on its own.
So I guess I have to call you again for this special topic. Now, Amiasta, my time is actually up. Please advise my viewers, young mothers and young men trying to become fathers one day, those who are just married and they are planning for it. General advice.
So what I would say is that, as we said, preconception care is very, very vital, because it helps you to plan your pregnancy. It helps you to rule out certain conditions that might affect the fetus and even the mother. So I advise that couples who are planning to conceive should visit the hospital for a preconception care, preconception counseling, in order to make them prepare for the journey ahead of them. And then also, we should try as much as possible as families. There's a family program. We should support couples going through this stage of their journey as married couples in order for them to come out successfully. So I think this is basically what I advise that I want to give out to them.
I'm so grateful. Thank you.
Right.
Now,
I will talk about only one thing. What we need to know, that every pregnancy is unique.
Yeah.
So do not say that my previous pregnancies, this is how I managed it, and this is how it went. So it's always normal. People are giving birth to 4 or 5 people for children, and they think the 5th one or 6th one, who are you to come and advise me? How many children have you given birth to? So yours is education. Mine only is
experience.
Every pregnancy is a unique thing on its own. So you need to listen to your healthcare provider and then follow the guidelines that will help you and then the baby as well.
I think it's been very, very educative and very, very informative for this knowledge that we've all heard. But what I want to add is that we are all unique and we are all different. How my body will respond to certain issues may be different from yours. So do not say that what happened to your sister is the same thing that is going to happen to your wife. So if your wife is complaining about something, you think it is normal, please, let's visit the hospitals. It is a family show, and so we are talking to the fathers. Support the women, please. Mothers, open up, share, communicate your needs, because if they do, they will also equally help you. And to the rest of the family, continue praying for them and stop bringing them concussions and other things to make the baby stronger. Rather, advise them to go to hospital. Same time next week when we come into your homes again with another interesting topic on Love at Home. I say thank you and we are grateful. Good night. Bye-bye.
Bye.